Well, COVID-19 has forced a lot of businesses to do things differently. Specifically in healthcare, systems have moved a lot of their appointments to be online.
Telehealth has increased in the past few months, and News 8 Now's Isabella Hulsizer found that La Crosse's healthcare systems plan on keeping them in place.
Hey, Nellie.
In April, telehealth appointments skyrocketed at La Crosse Health Systems.
We saw a lot of patients not willing to come in at all, even though they had very complicated conditions.
It's definitely an option, but not as accessible or prevalent as it is today.
The La Crosse Health Systems kicked telehealth into high gear over the last few months. Mayo Clinic officials say at their peak in April, they serviced over 1,300 patients per week virtually.
The video visits really allowed us to do is to stay very connected with those patients and assure they're receiving the level of care that they need.
Danielle George just recently started using telehealth services at Gunderson. She says she doesn't really have any concerns about security with the virtual visits.
The things that we talk about, are just general things that aren't anything that I'm super concerned about right now. So we can have those conversations.
George says the telehealth system makes getting the care she needs so much easier.
They can set up appointments for me, and then it gives me the availability and flexibility to take care of those things we talk about at my convenience.
Health officials worry patients don't realize their appointments can be done virtually and will risk not seeing a doctor to avoid going to clinics and hospitals.
They're talking about the COVID second wave, but they're also talking about a second wave due to delayed health care.
Leaders at both medical centers say they don't see this trend of telehealth slowing down anytime soon, even past the pandemic. In La Crosse, Isabella Hulsizer, News 8 Now.
And according to Gunderson Health System officials, its goal is to have 40 to 50% of primary care appointments done through telehealth.